Assalamu alaikum. I am Zargul and today I am going to present the topic developing therapeutic approaches for emerging viral diseases. Let's talk about introduction. In 21st century, more than 10 pandemics has already been occurred, from which the COVID-19 that was the most devastating event that has been occurred. As we all know, the viral diseases that are emergence to accelerate and they pose a significant threat to human health. So there is a need for development of therapeutic approaches that can be used for the future outbreaks. This diagram represents the overview of 21st century viral outbreak. All these animals they connect as a vector for virus families. For example, the camel that is the for the coronavirus SARS and the MERS that are the type of the coronaviruses, influenza viruses, alpha viruses, and the bat that can be used for the flaviviruses, guinea viruses, and the mosquito that can be used for the Hanipa viruses. SARS was the one of the first 21st century outbreak. That was the SARS outbreak, and in 2019 the COVID-19 that is also the variant of the SARS. All the coronaviruses that were originally traced back to the bat, but they can also use the camel and the cats as an intermediate host. Here is some points that represents the importance of therapeutic approaches. The first is the rapid response to the outbreak. If we have readily available therapeutic options, so we can reduce the impact of the disease on the human health. And the second one is the mitigating morbidity or mortality. Mitigating means basically it's an action that leads to the safer future. So if we have effective therapeutic approaches, we can reduce the severity of the illness and decrease the mortality rates which are associated with the viral diseases. The third one is the building healthcare resiliences. Developing a resilience portfolio for therapeutic approaches that will enhance the healthcare system. A robotic toolkit basically that is used for the treatment of the emerging viral diseases that will be effectively for the different diseases scenario respond. This is reduce the economical impact that can be also reduced if they that is linked with the healthcare cost, productivity lost, or the public fear. And we can also prevent the pandemic spread by this therapeutic approach. So these three approaches that can be used against viral diseases. First is the antiviral drug, the second is the vaccine, and the third is immune-based therapies. The first approach is antiviral drug. Antiviral drug targets the specific component of the viral life cycle. It inhibits their replication and their spread within the host. For example, remdesivir. Remdesivir is an antiviral drug that was initially developed for the Ebola virus, but they can also be used to treat COVID-19. The second approach is vaccines. Vaccines stimulate the immune system to recognize and initiate the defense against virus without causing disease. For example, Pfizer, BioNTech, and Moderna. These are messenger RNA vaccines. These vaccines were also used to treat the COVID-19. The third is immune-based therapies. Immune-based therapies utilize the body's immune response to fight against viral infection. For example, convalescent plasma. In this therapy, the plasma of recovered patient that will be used to treat the severe cases of that disease. There are two fundamental types of antiviral therapeutics. One is direct acting antivirals and the second one is host factor antivirals. In direct acting antivirals, that will antibodies directly attach to the virus and then neutralize that virus. But in the host factor antivirals, they would require the targeted element to neutralize that viruses. Now, how this happen, we will see in the next slide. I just take this picture to make understand. In this picture, the yellow color that represents the antigen, the black one represents the primary antibodies, the pink that will be fluorophores, and the blue one that is the secondary antibodies. In direct acting, there is no need any other factors. So the black antibodies, the primary antibodies that directly bind to the antigen that may be a bacteria or a virus, and then they will give the fluorescence. But in the host factor, indirect antibodies, they will, in which the primary antibodies firstly that will bind to the antigen, and then they will bind to the blue one, that is the secondary antibodies that will bind to the primary as a representative targeted elements for antigens, and then they will give the fluorescence. So this is the mechanism of therapeutic approaches. Hope you understand. In case of outbreaks of diseases like COVID-19, Zika, Ebola viruses, it will enhance the rapid response. But there are some challenges that can come in these responses, like rapid transmission, because due to the modern transportation and urbanization, viruses that can spread quickly across the borders. Secondly, viral evolution. Mostly viruses, these are the RNA viruses, so that can lead to the genetic changes and change their genetic makeup, due to which the treatment become very difficult to treat these viruses. Vaccine development, because in the case of the viruses like COVID-19, there is need of rapid distribution and the rapid creation, large amount of creation of the vaccine. But the challenge that can came in this process is basically the innovative techniques that are required for the vaccine development. And the fourth one is the antiviral resistance. Because the development of the drug resistant viral strains that can hinder the effectiveness of the antiviral treatments. In global coordination, collaborative efforts among nations are necessary to monitor, to detect and respond to the outbreak effectively. So these are the challenges that can came in the responses of the COVID-19 cases. Conclusion. I just gave the reference of the COVID-19 because it's the most recently pandemic. So COVID-19 response provides a blueprint for us to address the future viral threats, emphasize the need for swift actions, international collaborations, and the continuous advancement of the therapeutic strategies to safeguard the global health. These are the references. I hope you understand. If you have any question, you can ask. Thank you.